Bizarre medical legal cases, part 40. I'm going to try to be a little bit serious on this one because it was extremely sad and it should not have happened. So this was a case of a pregnant woman who was pretty much at the end of gestation, meaning that she was, I think it was 37 or 38 weeks. And so what basically happened was that she wasn't getting any medical care. She didn't go to a hospital. She just had some private doula that would come to her home, and I don't know what she did for her. But basically, the doula, when she came to the hospital, she told the nurses that, my baby's been sleeping for the past week. And so the nurses were extremely concerned. And so the reason why she actually entered the hospital this time around was because her sister, who came from out of state, told her, sis, a baby's not supposed to be sleeping for a whole week, especially near the end of the gestational period. And so she went to the ER and she was reassuring her sister that, hey, no, it's everything's fine. My doula says everything's fine. I'm planning a home birth, all this, whatever natural thing. And so then when she was hooked up to the fetal heart monitor, unfortunately, they found that there was no heartbeat. And so then she ended up, quite interestingly, the reason why it popped onto our desks is because she sued the hospital saying that, like, oh, it was traumatic for her. But eventually the case was thrown out simply because it was the patient choosing not to go to a hospital, not getting prenatal or perinatal care that ended up resulting in the demise of this fetus. Extremely unfortunate situation. And for more bizarre medical cases, medical legal coaching, and medical legal advice, subscribe.